Hello, my name is Rinath Jeselsohn. I'm a breast oncologist and physician scientist at the Dana-Farber Cancer Institute in Boston. And I'm happy to give a very brief overview of our recent study of the circulating tumor DNA analysis from the phase 2 PACE trial. So the phase 2 PACE trial was a study in which patients who have hormone receptor positive advanced breast cancer who had at least 6 months of treatment with palbociclib and an aromatase inhibitor were then randomized to 3 arms, including fulvestrant alone, fulvestrant plus palbociclib, or fulvestrant plus palbociclib and the PD-L1 inhibitor avelumab. The trial, when looking at the fulvestrant versus fulvestrant palbociclib arms, the trial did not show added benefit of continuing palbociclib in this setting. The trial did show a numerical improvement when adding avelumab to the combination of palbociclib and fulvestrant. In this study, we analyzed the circulating tumor DNA that was collected as part of this clinical trial, and ctDNA was collected at baseline from 200 patients on this trial. And we focused on the arms of the fulvestrant and the fulvestrant plus palbociclib to understand what are the genetic alterations identified through ctDNA that are associated with progression-free survival in second-line endocrine therapy-based treatments. So first off, when we looked at the baseline samples of the 200 patients, so again, these are patients that have all progressed on a CDK4/6 inhibitor plus palbociclib, but were on first-line treatment with this combination regimen for a reasonable period of time of at least 6 months. And what we found was that the most common genetic alteration or mutation in this patient population were the ligand-binding domain mutations in ESR1, which were found in more than 50% of patients. The second most common mutation was mutations in P53, followed by mutations in PIK3CA and GATA3 mutations and RB1 mutations. Interestingly, in this patient population, we found RB1 mutations in 10% of the patients, which is slightly higher than what has been reported previously in a similar patient population. When we looked at what are the associations between these mutations and progression-free survival, what we saw was that clearly RB1 mutations are associated with poor progression-free survival with a second-line endocrine therapy or endocrine therapy plus palbociclib, and progression-free survival with these regimens in patients who have an RB1 mutation was less than 2 months. We also found that P53 mutations, PIK3CA mutations were associated with decreased progression-free survival in this setting. And when we looked at the ESR1 mutations, we found that if we look at all ESR1 mutations, there was no significant association with progression-free survival on endocrine therapy-based treatment. However, when we look specifically at the Y537S mutation, which we and other groups have shown to have more robust phenotypes, we did see that the presence of a Y537S mutation was associated with worse progression-free survival in this setting. So in summary, we were able to present here in this study the landscape of the genomic landscape of patients post a CDK4/6 inhibitor plus endocrine therapy. And we also identified specific mutations that are associated with outcomes in this setting, which could help direct future treatments in the setting of second-line treatment of metastatic hormone receptor positive breast cancer.